Okay, we're just gonna prep the skin.
This is what solution?
This is an alcohol, isopropyl alcohol. This is just alcohol.
So she's not pregnant for 6 weeks or everything on it.
She's using the creams, and it's helped her melasma.
Too, if you saw me before, it's unbelievable.
We'll get the girls to pull up the pre-op, the pre-treatment pictures.
And have you stopped your weight gain like a week or so? You know what?
It's okay, you'll get everything.
Yeah.
So in terms of other cosmetic treatments from a plastic surgeon's perspective, I mean, she's gorgeous. Her nose is a beautiful dominant part of her face, big smile. I love projected noses. People think that the more projection in a nose, the prettier it is. But if you look at the asymmetry of the tip, which I do a lot of non-surgical rhinoplasties, you can see that the column, so this is the nasal tip. She has a broad base here, and the lower lateral cartilage is a cartilage that forms an arch, almost like a wishbone, on this area and also this area. And there's some asymmetry here. Over time, these two domes, which we call this wishbone, used to be like this,
Yeah, I did.
and now it fell.
Yeah.
So this side is a little bit more depressed. So there's no dominant nasal tip projection on the left side. So a little bit of filler there would be amazing.
I'll do anything.
You want to do it? Maybe we do it. No.
My Philistine I have lidocaine.
So we're gonna see.
Epinephrine.
You're allergic? Yeah. I think the filler that we use has lidocaine with it, and it has a blanching effect. So
What kind of fillers to use?
we use the whole spectrum, everything. I mean, there's more in Europe than here, but the Juvederm.
So what are you applying now?
So we're using the three-step peel.
So is that you're applying now?
You're starting to
So far,
burn.
so good. Now, yeah.
Is that lactic acid?
It's getting hot.
This
I'm
is-
acting
Lactic acid, sal acid, and TCA, 10%.
So you can see so she's not frosting yet. There's salicylic acid, so you'll see some keratolytic effect in the beginning. Open your eyes a little bit.
I'm gonna look so beautiful in the next 2 days.
You'll have a glow today.
I told my husband and I said, just don't leave me. Just in 2 days I'm gonna change on you. I told my kids too.
This is a very straightforward, reproducible peel that has a learning curve, but the learning curve is quick. That being said, I'm a plastic surgeon and I do a lot of surgery weekly, but I try to be involved in every single one of these because details of the feathering, I do a lot more feathering because I always think that the post-inflammatory erythema is a big problem with these, with any type of peel, because they have inadvertent sun exposure and then they get the. You okay? You don't like that blowing in your nose?
Yeah, because it's like a face.
So she's exfoliating daily, so she won't get as much of the exfoliation with the peel as somebody else who doesn't exfoliate.
How do you decide when to stop?
We usually, generally for a person, male or female of average size, we usually use the majority of the whole thing.
And you're just applying with light strokes and not pressing on this thing.
Yeah. She doesn't have any neck aging, so
See, we do the eyelids too. That's why you make your patients use the creams on your eyelids, so that everything is
This is lactic salicylate.
how do you feel?
It's a very good.
You're a tough girl.
You feel nothing?
Well, I don't let me see. It's burning, but it's not like that. super bad. Because you know the creams I use, when you start them, it's as bad as
Burns.
this. You know, very bad actually. So
That's the, I think, importance of priming the skin.
oh yeah.
Open your eyes.
By the time you get to this, it's not as dramatic.
Including salicylic acid.
In here?
There's still salicylic acid.
Yes, it's the same solution.
Here's the cheeks are the bones are
Is
the
it
ones
only
that-
salicylic acid? Are you mixed?
This has it's already pre-mixed.
Pre-mixed together.
It's already mixed
There's
together.
TCA in there too, right?
Pre and three. Three pre-mixed.
3 premiums.
Lactic salicylic
TCA.
and some retinol.
And after that, you're going to put the radical cream.
The mix is the
So
retinol
it's
cream.
from the prior version, you don't have any conscious sedation for this patient here.
These are in-clinic treatments, and they're part of a maintenance and also corrective regimen.
And it can be done every month.
Yeah, the people love them. They just feel great, especially for patients that are more, they have more sebum. It's really the salicylic keratolytic effect
And
is wonderful for
this,
that.
you have salicylic, especially darker skins, you will be worried about the pH.
You know, there's no specific point where you would develop PIH here, because it's an even distribution. So there's no cutoff points. If I did this and left it like this, no matter how good the peel is, no matter how minimal it is, it's just going to have PIH. But you see, I'm taking it all the way into the hairline, so we're creating a nice even distribution of exfoliation, and there's no reason for them to have any particular type of PIH. There's no endpoint, there's no differential between inflammation of this part of the skin versus that part. Okay, we're gonna put the second part. Let me just take
Second
that.
part is gonna burn more.
No,
Yeah.
this is actually
Now it
neutralizing.
calms it down now.
Here's your stingy cream.
Yeah, it's
first.
stinky.
This one stings. The next
Especially
one-
the cheekbones.
Yeah.
Yeah. But only the cheekbones.
This is a blue pill, right?
No, this is not.
This is not a blue peel. No, this
Not
is.
control deck. This is 3 steps.
You know how you know that? It's not blue.
It's yellow.
And this is how much.
Dr. Obagi, come.
Yeah, vigorously massage that until it vanished.
So what you put on
We're pushing it in.
This
This
is
is the retinol cream.
the retinol cream. It's neutralizing
Retinol
penetration and also.
Get right deep into the tissue.
Now this one is part of the retinol. You know,
This is
it's a
step 1
retinoid.
the acid, step 2 the retinol, step 3 the hydration.
So everything even. But this is a corrective step.
She will
So
not wash her face until tonight.
open your eyes, Monica.
Tomorrow morning she wash her face, apply the second step, retinol, to stem the skin further, and then the moisturizer 3-4 times a day for 3-4 days. That's it. Very simple. Wash the face and
How long are you
moisturizer.
gonna peel for?
2-3 days.
That's it?
The moisturizer is Pometrol. Pometrol.
I did the 60.
Moisturizer is Pometrol.
It's a pure.
No, we don't need Pometrol yet. There's no cap, no smoothies, no nothing.
The important thing is, don't pick your face.
Good night.
You want to do a correction of that nose?
Well,